Hello everyone, this is Chadi Alraies coming to you from New York NYEVS. I'm really privileged to be with Dr. Belal Kaseer, coming as a third-year fellow coming to the conference from West Virginia. Belal, thanks for being with us.
Thank you for having me, Dr. Alraies.
So tell me, you came here for the fellows course. So how was it, and what attracted this conference specifically?
So this course actually, I'm currently a third-year general cardiology fellow, and I wanted to learn about peripheral artery disease, and this was a great opportunity for me to come here and learn about variety of peripheral artery disease, learn from the experts well known in this field here. And yesterday we also had a simulation, so this was a great opportunity for me to have some hands-on experience also with different closure devices, and so I mean it was a great opportunity. So I really enjoyed my time here.
Yeah. So the hand-on sessions are really extensive.
Really extensive. We had the cadaver yesterday, and we were doing actual pre-closed device, and we also deployed a Saphira stent there. So it was really great.
That's perfect. Is this the first time being here?
Yeah.
All right. So again, we don't want to talk competition, but how do you see this conference different than any other fellows course?
This actually, very well organized conference. I was, my expectation was I thought it would be a smaller conference, to be honest. But here, a lot of fellows from different fellowships, like vascular, interventional, podiatry. So this is was also a great opportunity to talk to different fellows from different programs, learn about their system. So it's very, very well organized. I'm very happy to come here.
Well, thank you, Belal, for your time, and thanks for coming here. And
thank
maybe
you,
hopefully we'll see you in next venues as well.
Thank you so much, Dr.
Watch these videos and others on the YouTube channel. This is Chadi Alraies coming to you from New York NYEVS 2024. Belal, thanks again.
Thank you, Dr. Alraies. Thank you.
Thank you.